Okay, everyone. This video is Splenius, Capitis, and Cervicis, and also the Suboccipitals. So we are beginning on page 203 in your book. Let's get started. So Splenius Capitis and Splenius Cervicis are deep to trapezius and rhomboids, but superficial to the erector spinae group. Okay, so they're kind of in between the two. All right, Splenius capitis and cervicis are muscles that affect the head and neck, but unlike the other muscles in that area that run parallel to the spine, these actually run oblique to the spine. Oblique means diagonal, basically. Okay. Splenius cervicis is hard to palpate because it is deep to trapezius and rhomboids, especially where it is the thickest. But Splenius capitis is not that difficult to palpate. And in fact, Splenius capitis does cause quite a bit of issues with people as far as pain and discomfort. Sometimes it's levator scapula, sometimes it's Splenius capitis, and we'll be able to tell the difference in movement or action of the muscle. So Splenius capitis and cervicis. I'm going to make this just a little bit bigger here. Okay, so the origins, of course, are a little bit different, as you can see right over here. The origin of Splenius capitis, and the reason it is called capitis is because it inserts up in the skull. So capitis refers to the cap or skull. Splenius capitis originates on the inferior 1/2 of the ligamentum nuchae, which is not shown, but would be right here. Okay, right along the posterior cervical spine. Inferior half of the ligamentum nuchae and spinous processes of C7 to T4. Okay. C7 to T4, so right along the spine. Now it inserts, of course, up on the skull. That was part of the name, and specifically the mastoid process and the lateral portion of the superior nuchal line. So let's show you where the mastoid process is, right there. Okay. Make that a little bigger so we can see that. Right there is the mastoid process. So here's your ear, and in fact, that's your ear hole. It's called the external auditory meatus. Ooh, fancy. But posterior to that, so you've got your ear, here's your ear. You just slide your finger back, not even a 1/2 inch here, and right there is the mastoid process. Okay. Just slightly inferior to your ear as well, back and inferior. So look, here's Splenius capitis and here's levator scapula. So remember, I had mentioned that both of those can cause issues. They're kind of in the same spot. We'll have to pick them out individually by action. Okay. Here's trapezius, right? Here's Splenius capitis, there's levator scapula. So like I said, we will be able to palpate Splenius capitis. It is more superficial as far as layers are concerned than Splenius cervicis. All right, so let's talk a little bit about Splenius cervicis then. Cervicis originates just a little more inferior, so it's more in the thoracic spine. Transverse processes of, whoops, that's the insertion. It's like, no, that's not right. Spinous processes of T3 to T6. So here's T3. Remember, T2 is just in line with the superior angle of the scapula. So this one's T3. Okay. T3 to T6, spinous processes of T3 to T6. Or if you like to abbreviate, SPs of T3 to T6. The insertion, now we go to the cervical spine. Yes, of course. The insertion is the transverse processes of C1 to C3. TPs C1 to C3. 1, 2, 3. Okay. They are in sort of the same spots. They do run obliquely to the spine, so they are going to be able to do the same things. They are synergists. Unilaterally, they can rotate the head and neck to the same side. So they are ipsilateral rotators. Rotation to the same side is ipsilateral rotation. Remember? Good. Ipsilateral rotators. They rotate to the same side, and they can also laterally flex the head and neck, of course. Okay. Anything that can rotate can usually laterally flex as well. Bilaterally, they are on the posterior, so they're going to do posterior things, which means extension of the head and neck, right? Okay. So Splenius, Capitis, and Cervicis are ipsilateral rotators, lateral flexors, and extensors of the head and neck. Okay. Sits right next to levator scapula. Oh, Splenius, I forgot to mention this. Splenius, the word Splenius means bandage-like, like a splint. Okay, comes from the same root word. Okay, so we're going to move on to the suboccipitals, because the suboccipitals are roughly in the same area. So we're talking about muscles that are high up in the cervical and thoracic spine. Suboccipitals is on page 205, so we're just skipping ahead a page. And here we are. Suboccipitals are teeny tiny muscles that live really high up in the cervical spine. So they only attach really to C1 and C2. And of course, the occiput, they're suboccipitals. It's in the name. They're below the occiput, suboccipitals. You are not going to need to know the origins and insertions for these, okay? Just the actions. This is like the erector spinae group. Wah, which is lovely. Okay, so suboccipitals consist of rectus capitis posterior major, rectus capitis posterior minor, oblique capitis superior, and then there's another little one in there too, oblique capitis inferior. And they are on either side. So there's really 8 of them if you count them all together. Rectus capitis posterior minor. This one is a little bit unique because all of the other suboccipitals attach bone to bone, right? So you've got inferior nuchal line to C2, or inferior nuchal line to transverse process of C1. Okay, well, rectus capitis posterior minor does have one bony attachment, but then its insertion is actually on the meninges. And the meninges surround the spinal cord. There are 3 layers of protective coating around the spinal cord. The outer layer is called the dura mater, and dura means tough. Mater means mother. So it literally means tough mother, which I love. I think that's great. Of all the things to name, we name this one tough mother. So the rectus capitis posterior minor actually attaches to the dura mater, which is the outer layer of the meninges of the spinal cord, which means that this little guy can actually pull directly on the spinal cord if it is tight. So this can cause some pretty significant headaches on occasion. There's also a lovely nerve, a series of nerves actually that exit the spinal cord here and run up the back of the skull. And again, if these are really tight, they can cause these really horrendous tension headaches and nervous system headaches. So we will be working with the suboccipitals in massage therapy without a doubt, but because these are so deep, we cannot directly palpate these. I mean, these are the deepest thing in there, okay? So we've been talking a little bit about layers. Well, we have the erector spinae, we have the transversospinalis group, and then we have the suboccipitals, okay? So we can affect them by pushing into the tissue that is superficial to these, but we will not be able to palpate them directly, okay? Now, what do these suboccipital muscles do? Well, because of their position, they can't do a whole lot, but they do rock and tilt the head into extension. So the suboccipitals, I'm going to stop the share for a second. The suboccipitals are what I like to call the what's up muscles, because that's what they do. They don't extend the head and neck like other muscles. All they do is rock and tilt the head back. So, you know, when you see a friend of yours kind of across the street, you can't really say hi or have a conversation. You just pass each other and it's like, sup with you, right? That is what suboccipitals do. They rock and tilt the head and neck. So it's just that little movement, not the big extension movement. They can do a little bit of rotation because of their position close to C2. Remember, C2 has the dens and allows you to do this movement. And just the littlest, teeniest bit of lateral flexion. Again, it's only between C1 and C2. So, you know, even this is a little too much, but I don't know how to just laterally flex my C1 and C2. Your guess is as good as mine. So that is what the suboccipitals do. So they're really high up in the cervical spine, just inferior to the occiput. And of course, they attach to the occiput. And if you rub back up in here, there are so many layers. There's 9 layers just in that little area alone. And the suboccipitals are the deepest. So you really have to push into that area in order to affect the suboccipitals. But it feels amazing because that's where headaches live, you know, specifically tension headaches. And a lot of your clients are going to experience those. So that's a great place to get in there and work with your fingertips, okay? All right, that's it for Splenius, Capitis, and Cervicis, and the suboccipitals.